Good evening, friends. This is Dr. Vineet Sehgal, and we welcome you to our session of AIIMS new pattern questions. So, I would be your ophthalmology educator, and as I have told you earlier, that this course would consist of the new pattern questions that are asked in the AIIMS exam. So, today I would tell you about the assertion and reason type questions. So hope you remember that during your UG exam also, that is the PMT exams, so you would have got, if you have gone through the AIIMS exam, you have got some assertion and reason type of the questions. So the pattern is the same, but remember here in your PG exams, if they ask the assertion and reason type questions, it involves more concepts in it. So I would give you an example. Let's say the assertion is gonioscopy is indicated in all cases of blunt trauma, and the reason is patient can develop angle recession glaucoma. So your options are both assertion and reason is true, and reason is true explanation of assertion. Both assertion and reason is true, but the reason is not true explanation. Both assertion and reason are wrong statements, or assertion is true but the reason is wrong. So here you see that we have asked about a question in the glaucoma. So gonioscopy, which is an investigation to detect the primary angle closure or primary open angle glaucoma, it can also detect an angle recession. Okay, so whenever there is an angle recession, this means that there is a significant trauma to the trabecular meshwork. Okay, so those patients who are having an angle recession after a blunt trauma, they have very high chances of getting glaucoma. Okay, so both assertion and reason is true, and the reason is true explanation of the assertion. Okay, so let's move to the next question. So similarly, the assertion was LASIK is not done at an age less than 18 years. Reason, stabilization of refractive power is needed before the surgery. So as you have learned in our LASIK session, that LASIK per se is not advisable when there is a fluctuating refractive error. So that's why that it is reserved for only those candidates who are more than 18 years of age and have a stable refractive power for at least 6 months. Okay, so here also both assertion and reason are true, and the reason is the true explanation of the assertion. Okay, so now we move to another question where let's say assertion is beta blockers are the drug of choice for primary open angle glaucoma. Reason, they provide the maximum reduction of intraocular pressure. Okay, so now see this question. So let's see the first assertion. Beta blockers are the drug of choice for primary open angle glaucoma. So this is wrong. So what is the drug of choice for primary open angle glaucoma? So it is PG analogs. Okay, so the PG analogs are the drug of choice for primary open angle glaucoma. They provide the maximum reduction of IOP. This is also wrong. So the PG analogs basically give the maximum reduction of intraocular pressure. Okay, so both assertion is wrong as well as the reason is the wrong. So the answer here is C. Let's move to another question from the dreaded topic of squint. So base in prism is used for exotropia. The image is shifted towards the apex after passing through the prism. So first we see what is base in prism. So let's say this is the base of the prism and this is the direction of the apex. Okay, so this is called base in prism. Okay, so let's say this is my nose. And what is esotropia? Esotropia is convergence of eye. Okay, so let's say one eye is seeing normal, okay, and the other eye is having a squint, which is inward deviation. So remember, whenever you use a base, a prism in a patient of squint, your direction of apex should be in the direction of squint. So here you should have given a base out prism, okay, not base in but base out, where the apex is in the direction of the your deviation. Okay, so here assertion is also wrong. Okay, and the reason is also wrong. Okay, so your answer is C here. Okay, now the next question is indirect ophthalmoscopy is investigation of choice for retinal detachment. The magnification of indirect ophthalmoscopy depends upon the condensing lens used. So here you see that the indirect ophthalmoscopy is definitely the investigation of choice for retinal detachment. So A is correct. Okay, sorry, the assertion is correct, and the reason, the magnification of indirect ophthalmoscopy depends upon the condensing lens used. So this is also correct. Okay, both of these statements are correct. So let's say if you have a condensing lens that we use, let's say 20 diopter, so your magnification would be 3 times. But is this the reason why an indirect ophthalmoscopy is used? The answer is no. The indirect ophthalmoscopy is used for retinal detachment because the retinal detachment most commonly occurs due to presence of retinal tear, and these retinal tears are usually in the periphery of the eye. So with the indirect ophthalmoscopy you can see the periphery of iris also. Okay, so here you remember that both the assertion as well as reason are true, but reason is not the correct explanation. So my answer here would be B. Okay, so now you have an idea that how to interpolate your assertion and reason into the best fit option. Okay, so we would also like you to basically register for the Unacademy NEET Plus PG course, and here we would have single best answer type questions, multiple true false questions, match the following questions, sequential arrangement questions, multiple completion type questions, and the reason assertion type questions. Okay, so use my code Vineet Sehgal RPC AIIMS 4415 to get 10% off. Let's crack it.